Your lymphedema, taking back control. Self lymphatic drainage can help improve lymphatic drainage from an area that is congested or damaged, soften and improve skin condition, and can make you feel more in control of the management of your lymphedema. The technique shown in this video is based on FG-MLD and the fill and flush technique from the Lymphoedema Training Academy. There are many different methods, and you may have been shown one that is slightly different. Discuss this with your practitioner. This film is not designed to replace individual advice given to you by your practitioner. Self-lymphatic drainage should not be carried out if you are undergoing active cancer treatment, such as radiotherapy or chemotherapy, have an infection, have had a recent thrombosis, or an untreated heart condition. If you are at all concerned, then discuss with your practitioner or family doctor prior to starting SLD. Although you can use this film alone, it has been designed to be used alongside the LSN self-management book, Your Lymphedema, Taking Back Control, which can be purchased from the LSN website, www.lymphedema.org. Remember, as with anything in life, learning SLD needs lots of practice, persistence and patience to perfect the movements and sequences, but it will soon become second nature.
Hi, I'm Denise Hardy. I'm the nurse specialist here at Kendal Lymphology Centre, as well as being the nurse advisor for the Lymphoedema Support Network. For how long, I have no idea. But here I am today talking about simple lymphatic drainage. And we're going to go through the sequences that have recently been published in our book about managing lymphedema. First of all, before we just touch on the SLD, I wanted to just remind everyone about the lymphatic system. This obviously is what we're going to be doing a lot of in the next half an hour or so. The lymphatic system is crucial for removing fluid and waste products that happens all the time. It's produced constantly. And as a result, if you've got an obstruction or an overload of lymphatic fluid, then we're going to get lymphedema. And so simple lymphatic drainage gives us a way of improving that drainage. The deep system you can see here on this poster. But on top of that, we have a very superficial network, which, if you look at this very crude tool that I'm showing you, is a little netting here. And that really mimics just what the superficial network looks like just underneath the skin. If we look at it in a 3D form, we see these filaments here, which are anchored to the tissues. And by gentle movement of the skin and the tissues, these tissue filaments and networks move, and as a result, fluid can move within it. There's no valves or anything stopping it, it's all interconnected. And so any movements that we do within the limb, we can move fluid around obstructions or to areas where fluid can drain more easily. So by using SLD, we can actually get fluid to move in different areas to parts that are not congested. And hopefully by doing that, we can ensure that the fluid drains away more efficiently. And as a result, your lymphedema will reduce. So who can do simple lymphatic drainage? Well, you of course can do that, and we hope we can teach you. Having said that, a carer or a relative, your spouse, can help you too. It's often sometimes easier to do that, but essentially it's you who's got to manage your lymphedema. So we're hoping that you will be able to do it, and our instructions, I hope, will be simple enough for you to learn over time. It does take practice and patience, but if you can do it, you will get really good results from reducing your lymphedema. When is simple lymphatic drainage useful? Well, hopefully it'll be something that you start to do every day as part of your self-management. But perhaps you're going in to have decongestive lymphatic therapy or intensive treatment with your lymphedema team. It's very, very useful to do it while you're in bandages, so keeping up with the lymphatic drainage is really helpful. We do it too predominantly for those who've got midline swelling, people who've got genital edema, people with breast edema, or those with facial edema too. So it can be really helpful for anybody, whether it be leg or arm or in the trunk, as I previously mentioned. It can be also helpful for those who've got scar tissue, scars from a breast cancer perhaps, or even trauma for any sort of surgery, or even a road traffic accident. The lymphatic drainage, we can teach you to gently soften up those areas and particularly areas of fibrosis, as we call it, or hardening of the tissues that sometimes occurs with lymphedema patients. And finally, for those who use an intermittent pneumatic compression therapy, then if we implement simple lymphatic drainage before and after, we've got a much better chance of that fluid draining away more efficiently. We often have to avoid doing SLD, and the cases that we suggest that is when you've perhaps had an infection, an acute phase of infection. We want that infection to settle down. Perhaps you've had a recent DVT, deep vein thrombosis. Again, it wouldn't be wise to do simple lymphatic drainage at that time, and we usually advise around 8 weeks before you start initiating your simple lymphatic drainage again. Perhaps you've had a heart problem. Again, we want that to settle down, we want it to be stable, and we would speak to your medics about that before suggesting that you continue with your SLD. And finally, perhaps you're in active cancer treatment. Perhaps you're having chemotherapy or radiotherapy, and there's just too much to be doing at that particular time to concentrate on SLD, so perhaps that would take a back seat. So those are the main areas really that we wouldn't do it. So what about when we do it here in clinic? Well, we do a lot of teaching. We really want you to get that sequence correct. And as I've said earlier, it takes a lot of time to do that. You think you've got it, but when you go home, you've forgotten what we've said. And that's why having the handouts and the book is really helpful. But when we do the lymphatic drainage, we don't really use any cream or oil. You might have had lovely massagers elsewhere, and they use lots of lovely lotions and potions. But when we're doing simple lymphatic drainage, we want to actually get the contact of our skin on skin. We want to be able to manipulate and move the fluid which is in these vessels underneath the skin. We don't do it hard, we do it very gentle, but we want enough pressure to be able to move the skin over the underlying tissues. If it's too hard, you will redden the skin, and that's just too much. We'll guide you, we'll help you, but just a gentle movement where you can see the skin wrinkling is usually plenty enough pressure for that sequence to work well. You'll see that we start our SLD by doing deep breathing. That helps this deeper system to work more efficiently. So that's a really important part of the sequence that we'll be teaching you to do. We want you to do it well, and we want you to do it efficiently. Our movements are also very slow. This system is sluggish. It doesn't drain very quickly. So if we try and encourage it to drain more efficiently, it won't work as well. So keep the movements nice and slow. We usually do about 4 or 5 treatments a day, or encourage you to do that. That sounds a lot, I know, but it only takes about 10 minutes to do it. We do about 4 repetitions each time. And once you've got that sequence in your head, it literally takes just a few minutes. The more you can do it, the more efficiently that lymphedema will drain. Eventually, you might only have to do it once a day, or even none. So it's really worth doing it in the initial stages. Here at Kendal Lymphology Centre, we are looking at simple lymphatic drainage as taught by the Lymphoedema Training Academy. I've done lots of different courses over the years. I've been in lymphedema a long, long time, so I've picked up lots of different methods. But predominantly we teach the same every time, trying to keep it simple, trying to keep it stable. We also use balls that you'll see in our treatments, and these are used in areas where we have lymph nodes or lymph glands. These help to empty nodes, so by putting them into an armpit, for example, we can squeeze against them, and that will help to empty the nodes. We will then move fluid using our hands, and that will then drain into those nodes that we've emptied. If you don't have a ball, and many of the lymphedema clinics will provide you with one, or you can buy one, of course, from the Lymphedema Support Network. But if you don't have one of those, or the dog's eaten it, for example, then a rolled up flannel would just suffice. Just roll up a flannel and again put that into the area where the lymph nodes are. Gently squeeze, and that will empty the tissues, the lymph nodes accordingly. You can also use other tools to help you. If you don't feel that your hands is good enough, you don't feel that you've got the right pressure, then perhaps you could use a massager like this. It's literally just a very small brush or tool, and it literally just sweeps across the skin. You don't need to put any pressure on at all. Really effective. Perhaps you don't like touching your own skin. Perhaps your partner doesn't want to do it and prefers to do this. They get the pressure just right with that. So that's something that can be very useful. We can use rollers. These are just paint rollers from the DIY shop. So think of anything you can do to actually move the skin. This is an electronical massage, a battery operated. It just literally needs to be rested on the skin and the skin will move gently. You'll find your own things that work for you. This is a very old, very antiquated tool that we often used to use years ago. It looks a little bit formidable now, but it still works, particularly on very large areas. So those rolls just roll nicely and help the skin to move more efficiently. But lots of different things available now. Those are just a very few that are available at the moment. So simple lymphatic drainage is really, really helpful, as you'll see from the sequences that we've recorded for you. We hope that you'll follow them and learn from them, but we hope that you'll do them. Hopefully, again, your lymphedema teams will practice and give you more solutions to your own particular lymphedema. Everybody's different and perhaps the sequence might change a little bit for you, but it will not work overnight. You do have, as I've said earlier, you do need to practice, you need to be patient, and you need to persist in what you're doing. The more you do it, the more effective it will be. And of course, do remember that it's not a standalone treatment. It won't work on its own. It's not the only thing that will help your lymphedema. You'll need, of course, to use your compression garments. You'll need to do your skincare. You'll need to exercise. And of course, you'll need to watch your weight. But simple lymphatic drainage is a really useful tool to use alongside those. I really hope it works for you. Good luck.
Self Lymphatic Drainage, SLD, for the breast and chest wall.
Okay, Julie, so today I'm going to show you some simple or self-lymphatic drainage for your breast, and it's your right breast that's been affected for the purpose of this video. So we're going to have a few movements that I'm going to show you and you're going to do with me.
Okay.
And we're going to start with some deep breathing. And this is to empty the space up here and to clear some space for that lymphatic fluid to move, and also just to stretch you out a bit at the beginning of this. So fingers to the centre of your chest, and take a deep breath in as you stretch your arms out to the side. That's right, try and stretch your fingers back as far as you can, that's fabulous. And then relax and breathe out as you bring your fingers back to the middle. And another one like that, please. A deep breath in. And breathe out as you bring your fingers back to the middle. That's great. And a third one. Really stretch those hands out, that's lovely. And relax. And a fourth one. That's fantastic, and really feel the pull on that arm, that's lovely. Okay, well done you. And the next thing we're going to do is empty the nose, which are near our collarbones, and this is where the fluid from your breast actually drains back into the bloodstream up here, into the blood supply. So all the breast fluid, the lymphatic fluid, comes through various channels and gets back into the bloodstream here. And when you bring your fingers up to empty the lymph nodes here, this is the kind of pressure that I want you to use. So it's enough to wrinkle the skin. It actually puts quite a bit of pressure on those channels there. And it's done very slowly to try and encourage that fluid back into the bloodstream. So we're going to start by emptying the nodes at the collarbone on the unaffected side, or the lesser affected side. So if you could find your collarbone, that's the bit that sticks out, and put one finger above and one below, out towards the shoulder side, and then gently stretch that skin all the way back towards the middle notch of your neck there. That's absolutely brilliant. Okay, and then again, lift the fingers off the skin and do it again, starting at the outer part, bringing it down towards the middle. That's fantastic. Gosh, you've got that one. Two more like that. That's excellent. Lovely.
One more.
And one more to make four. That's great. And we always start with the unaffected side, and then we move on and do exactly the same on the affected side. If this is sore, or if your arm is difficult or painful, or you can't reach like that, some people actually use a ball and they put that on the corner of their neck here and use that to squeeze the lymph nodes by raising their shoulder or turning their head to the side. But you're managing really well with your fingers.
Okay.
So if you could empty the collarbone nodes with that hand as well, same thing, nice and slowly back towards the notch in your neck. That's perfect. And then always lift the fingers off the skin back to the beginning. That's great. And number 3. That's fabulous. Well done. Great. Now we're going to empty the lymph nodes in your axilla or your armpit. And again, we always start on the unaffected side. So I'll give you this clean ball and show you how to do this. So you're going to pop the ball under the armpit and just slowly squeeze the ball down to put some pressure on those nodes. You might have to hold it in place so it doesn't pop out. Or you can do a little circle around the ball to empty those lymph nodes. And then lift the arm. And then repeat. And we're going to do 4 slow squeezes with the armpit there. That's great. That's brilliant. Some people actually use rolled up socks for this, or if they're out and about and they can't find a ball and they feel a bit achy under their arms, they just put a fist in their armpit and squeeze it on their fist. But the point is that we're emptying any lymph nodes that are in that area. Even if you've had lymph nodes removed from that area, you can still use this and affect the surrounding area around those lymph node areas. That's great. I think you've done more than 4 there.
Yeah.
So you can swap over now and move to the affected side. Same thing on this side. And if this armpit is a bit more tender than the other one, don't go too hard. Just do it as much as is comfortable, but you really try and squeeze down on that ball to empty that area around there. That's great.
Slowly.
Slowly, always slowly. These lymph nodes take about 4 seconds to fill up again, so it's no point doing it too fast because they haven't had a chance to refill. Perfect. Excellent. Lovely. Right, we'll pop your ball down for a moment. The next thing you're going to do is your chest wall clearance, and you're going to use this hand because I want you to sweep all the way across the top of your chest wall, right from that shoulder all the way as far as you can reach. If you're clever, you can reach all the way to that shoulder, but you might have to switch hands and push rather than pull. But try pulling all the way across as far as you can go, just straight across the top towards the other shoulder. If you can reach right to the shoulder, you've done well. If you struggle there, you need to swap hands and keep pushing it just to the shoulder. That's fine. That's as far as you need to go. And 4 times again. Everything's done 4 times. That's lovely. And a slow sweep across. That's great. Well done. Always moving from the affected side to the unaffected side. Okay, well done. I think that's 4. We'll just pop this back on for now. And just for the purpose of this video, we're going to divide the breast in our minds into 4 quarters. 1, 2, 3 and 4. And we're going to work on each quarter of the breast. Before we move on to the quarters, I need you to repeat that ball squeeze under the armpit. So if you start
Both
on
sides?
the unaffected, yeah, 4 squeezes on that one and then 4 on this one. That's great. Well done. Brilliant, that's great. And now we're going to start working on each quarter of the breast. So we start on number 1, which is the inner upper quarter of the breast. And you're going to remove the fluid from this area, just this section. So I'm going to ask you to sweep across the breast again, but just from the halfway point. You don't need to start from all over here.
Best doing it with the opposite.
Yes, best with the opposite hand. And either you do it with the hand and sweep it across. I think this number 1's going to come off here, but you sweep it across to the other side with your hand. Or if the hand is awkward, you can always use a little roller to do it with, some kind of a roller. But try it with your hand for now.
To the middle.
All the way across, as far as you can again to the far shoulder. But just from this quarter this time. That's great. So you're in effect emptying the fluid out of this quarter of the breast, which will be important in a minute because we're going to move some more fluid into that emptied area. Excellent. And now ball, but only under that one because we've actually just pushed some fluid towards that armpit, so just that armpit this time. 4 little squeezes there. Excellent. Now we're going to empty quarter number 2 up into quadrant number 1. So we need to bring the fluid from the bottom up to the top. I think this is going to come off, so we'll take it off now. That's right. Just straight up from the bottom to the top one. Just one smooth move, 4 times.
That's like that?
Yeah, that's excellent. If the tape comes off, don't worry. It's just for a demonstration to the quarters. Well done. Fantastic. Now we've moved some fluid up to here, so this fluid we need to move it across to there. So it's the full sweep now across from this quarter all the way over to that shoulder. That's great.
Just straight across.
Straight across as far as you can to the shoulder. That's 3. Great, now you know what comes next. We've filled that armpit up, so we need to empty it again.
Squeeze it. Okay.
Lovely. Okay, we've emptied that one and filled that one up. So now the next thing is we
3
need to move
to 2.
3 to 2. That's going to come off here, so we'll take that away. That's right, just straight underneath the breast there, or the chest wall. That's great. I think I have done with these. No, that's brilliant. Okay, we filled this one, so now we're going to empty that one up to the top. That's right, let's take that one away because that one's going to disappear now anyway. So fill to the top of the breast tissue there. And if you've had surgery here and it's sore, obviously you don't press very hard because you would be working on skin here. And actually, if you've had a mastectomy and a breast removed, then we're just working on the chest wall, the skin of the chest wall. We're not working on breast tissue at all. But the chest wall can have swelling in it as well, can have lymphedema in it. So you think you've done 4?
Then across.
Cross, well done. Well remembered. Excellent. I know what happens next. Brilliant, well done. Now this 4th quarter we treat in a slightly different way. Often the fluid from this quarter of the breast or the chest wall doesn't want to come all the way around. It actually wants to move backwards, and a lot of people say that that's where they feel a bit puffy under there. So instead of moving this all the way around or straight across, now we're going to push that up towards the axilla or even a little bit further round towards the side. So if we could use whatever's comfortable. If that hand is, I think you're going to be a bit awkward with that hand. Let's try pushing rather than pulling. Pushing with the flat of that hand round to the sort of halfway mark under the armpit. Perfect, yeah.
More like that.
Yes. We can get rid of that number 4 now, I think, can't we? great. That's great.
Right round.
Yes, as far round as you can reach, pretty much. Aiming it for the armpit. That's great. Brilliant. That's lovely.
So then a squeeze on that side.
We're going to have to do both again. So for this part of it, again, always start with the unaffected if you can't remember which side to start on. But then you're quite right. We're going to move back to this side because we've filled up those lymph nodes again here.
Okay, straight to the other side.
Straight to the other side. That's great. That's brilliant. Nearly finished. 2 more moves. You're going to empty the collarbone, but just on this side. So using the opposite hand, just stretch that skin from the shoulder down towards the notch in your neck to empty the collarbone nodes there. That's it. 4 of those. Still nice and slowly. That's perfect. Brilliant. Well done, Julie. So we'll finish off just with some deep breathing, just to finally empty out the space up here and just to relax at the end. So fingers to the chest bone and a big breath in as we stretch out. That's great. Stretch your hands out and relax down. Fingers to the tips there. And 3 more like that. Deep breaths. Excellent. Fabulous. Well done. Okay, that's it. That's your sequence. Well done.
We really hope you found that video useful. Remember though to speak to your therapist about doing the SLD massage. She might be able to make it more individual to your own particular needs. You'll remember during the video that we used the lymphatic balls. These were introduced into our simple lymphatic drainage techniques by Professor Belgrado, and they've been really useful, particularly when emptying nodes, which you can do at any time during the day. Emptying those nodes will really help the lymphatic drainage to work more efficiently. So remember to do it more often if you can. The more you do it, the more efficiently your lymphedema will drain and reduce nicely. There's one thing we didn't mention during the video, and that was that you shouldn't do the lymphatic drainage over your compression garment. Either take the garment off and perform the massage then, or just work on the root of the limb, where the sleeve or the garment ends. That would be much more pertinent. And of course our models that we used during these SLD demonstration, they did have clothing on. We would recommend that you did it skin on skin. That really has a much better effect. So again, we really hope you found the video useful. Remember to look at your book. The book, Your Lymphedema, Taking Back Control, covers all aspects of simple lymphatic drainage that you've seen today. So please refer to that and any other aspect of lymphedema that you'd like to learn more about. Thank you for listening.
Thank you to Denise, Jo and all those at Kendal Lymphology for sharing your expertise so willingly. To our wonderful models Phil, Julie, Jim and Martin, to Jacob at lockeddoor.co.uk and to you for watching. The LSN is a charitable incorporated organisation registered with the Charity Commission in the UK, number 1193800. The LSN receives no statutory or NHS income and is reliant on the generosity of our supporters to fund our work. If you would like to support us, please click the link below or go to www.justgiving.com/lymphedema support.